welcome to phase 2 of my presentation on cognitive behavioral therapy, otherwise known as CBT. Today we're going to be talking about strengths, weaknesses, and then comparing and contrasting the therapy as a whole. Before we get into that, the next slide will be just a quick little review on cognitive behavioral therapy, and then we'll jump right into those strengths. So briefly, as we discussed in phase 1, CBT is comprised of identifying negative thoughts, challenging negative beliefs, developing coping skills, practicing positive behaviors, setting goals, addressing underlying issues, building self-esteem, and improving relationships. So that is the core of cognitive behavioral therapy. So let's jump right into the strengths. All right, welcome back. Let's get into the first strength of cognitive behavioral therapy. Let me hold this up for you guys. So, the first strength of cognitive behavioral therapy is there is tons of evidence-based data and research on the efficacy of cognitive behavioral therapy. It's been proven to work, and it's been studied on multiple populations, including children, groups, obviously adults, and on various diagnoses. So if someone is new to therapy, and since we're in the Dr. Google, Nurse GPT era, someone new to therapy can look up a lot of credible information and a lot of credible evidence-based research on CBT before even starting therapy. So that brings a little bit of comfort to know what they're walking into. So CBT is one of the top therapies because you can look up exactly what you're getting into, and it's also evidence-based, and it's also something that has been researched for several decades. So the second strength of cognitive behavioral therapy is this. What do you notice about this? If you said pattern, you are correct. CBT focuses on changing patterns of maladaptive thought, which help individuals manage their emotions and behaviors efficiently. So clients can see positive change in their patterns relatively quickly by analyzing their thought processes. It also gives them control when life seems out of control. So for example, someone can reframe a thought by challenging that thought. Let's say they think, I can't stop drinking. They can reframe that to, with support, I can decrease my drinking. So with changing that thought, that will change the pattern. And if you're able to change the pattern, the way CBT is defined is you're able to effectively change the behavior. And with new patterns, new positive patterns, you can initiate positive behaviors. And that is one of the big staples of CBT, and you can see that relatively quickly. Another strength, piggybacking on the ability to change your thought patterns relatively quickly, CBT is structured and goal-oriented, making it easy to measure progress and outcomes. So a lot of treatment facilities do derive their monetary payment from being able to prove that the therapy that they offer, whether it's individual, in group, or in an inpatient setting, that their treatment is effective. So the fact that CBT actually is very easily able to be tracked, and the measure of the progress and outcomes is something that is built into the therapy, makes it very beneficial. The structure of tracking patients is also ideal for legal matters and insurance entities. For example, we could talk about, I get a lot of clients that during divorce, they're trying to prove that they are stable when maybe there was evidence of once they weren't stable enough to have partial custody or joint custody of their children. So they go to therapy, and them and the therapist work together, and then sometimes those documents are used in mediation, and CBT notes show strictly this is where this person is, this is where they are, this is what we're working on, and on a week by week basis. And that documentation can help prove that they are stable enough for the whatever range of custody that they're looking for. Also, in juvenile cases, sometimes instead of sending anyone under the age of, I think, 17 in Texas, like straight to jail, they are required to do therapy. And so they're parole officers sometimes look into, are they attending therapy? How does their thoughts change from when they first started, directly after the offense, and where are they now, in order to decide if any type of either parole or adjustment to any probation arrangements. So therefore, that tracking of the progress is very important, and one of the reasons why CBT is very beneficial. The fourth strength we'll get into is CBT can be adapted for different populations and settings, including children, adolescents, and adults, as well as CBT is effective in individual and group therapy formats. So my little buddy Cody here, if he needed to process, I think he had as a new sibling coming, that he could process that with CBT. Now there is a range to where talk therapy is beneficial. So usually it's somewhere between like 6 and up. And, some 6-year-olds nowadays, are able to process, but obviously the child has to be able to process. And then of course we have adults, adolescents, and groups. In varying formats, let's step away from individual therapy and talk about IOP, intensive outpatient programs, PHP, partial hospitalization programs, and inpatient programs. In those programs, we have individual therapy takes place 3 to 5 days a week or every day till they're discharged, and you have individual and group. So it's up to that therapist to pick a therapy theory that is able to reach multiple diagnoses. So everyone might not have depression. Some people might have, different disorders just around maybe the same range. So CBT is very good at actually connecting to different diagnoses. So that's why it's one of the staples of group therapy and intensive outpatient programs and PHP programs. It also helps the group, challenge their thoughts, their feelings, and behaviors, to where you don't have to specifically focus on any individual diagnosis in the group setting, which would, maybe alienate other people who don't have that diagnosis. Let's talk about delivery and increase access to care. That is one of the main strengths of CBT as well. It's able to be delivered in various formats, including face-to-face, online, and telehealth. So someone can attend therapy on their break. I have a client at the VA, and so she works 8 to 5 strictly, and then after that she has to go home and tend to her duties. She's a mother and a wife, so she actually attends her therapy on her break. She gets an hour break, so she's able to sit down and able to kind of get that rejuvenation during the day. CBT isn't something that's a long or drawn out complex therapy. So it's something that, hey, this is something that happened, and then they're able to challenge that on the spot and work through that. And that brings the accessibility and the increased access to care to many different populations. For most of us, especially in Western culture, that do work a 9 to 5, some people even 12-hour shifts, they're able to still get their mental health needs met. So let's talk about another major strength of cognitive behavioral therapy. It's cost effective. So cognitive behavioral therapy is actually more cost effective than other therapies out there, because you can actually get a lot of progress with just once a week, sometimes even every other week, cutting down costs. It's insurance friendly, as we talked about in the previous video, to where insurance will cover it. In the next slide, we will see how much therapy actually costs if it's not covered by insurance, and it's relatively high. So it's almost half that amount. So with in-network coverage and ability to do that, utilizing CBT, because it is evidence-based, so insurance does buy into it. And then we also have EAP, which stands for Employee Assistance Programs. Employee Assistance Programs pay for a certain amount of therapy for anyone employed by that employer through their insurance. So CBT, once again, and CBT therapists are on these EAP panels. So if you work for, let's say, Walmart, and you're like, you know what, I don't have the money for therapy, I'm going to use my employee assistance benefits, and they pay for 5 sessions, a year, and that you're looking for a specific therapist. Most of the time, the insurance panels have an EAP list of therapists, and those therapists tend to be CBT, because to be on these insurance panels and to get that reimbursement payment, you have to be practicing a therapy that is evidence-based and supported by data, which, as we talked about in the first strength, cognitive behavioral therapy. So here's just a chart that's showing that obviously therapy is quite costly. If you don't have a way to get it covered by an insurance policy, or you can't find it for free based on qualifications of income. So it is of value to the population for them to seek therapies that are evidence-based, that can be covered. Insurance co-payments, which is the payments after you pay your insurance premium for the actual services, can be anything with insurance from $0 to about under $30 versus over $100, as you see in this chart here. So CBT's major strength, or one of its major strengths, is obviously the fact that it is something that is affordable and accessible to the general population. So we've talked extensively about the strengths of cognitive behavioral therapy, CBT. So now let's look into some of the weaknesses. First of all, CBT may not address underlying trauma or complex emotional issues. So, best example I have here, you can see that this is Batman. And if anyone is familiar with the story of Batman, what gets him into becoming a vigilante mass crusader is both of his parents were murdered in an alley, and he never actually had a chance to process that. So he never dealt with it. So he spends his life fighting crime, but also trying to find out who actually murdered his parents. The story of Batman is he's actually one of the, I guess, highest rated detectives in their little comic book universe, and he still can't figure out who killed his parents. And so that causes him, obviously, emotional trauma. So the way it affects his life is Batman is obviously spends his nights beating people up, even though he's a rich millionaire. So that may be a maladaptive kind of thing. And the way he processes it, though, he does do good, but he's also lonely. He's never married. He's incapable of sustaining long-term relationships. He's incapable of emotional vulnerability. So someone like this, probably CBT would not be very effective. CBT focuses on current thoughts and behaviors and potentially overlooking past experiences and root causes. In the clinical setting, it actually causes an increase of referrals by CBT therapists. So sometimes you do have to process the trauma in order to move forward. And if that therapist is CBT trained but not necessarily trauma informed, then they have to make that referral to another therapist, and unfortunately the client may have to start all over again building that rapport with a trauma informed therapist. The next weakness to discuss is CBT requires a high motivation and cognitive ability, which may not be present in all clients. A key staple of cognitive behavioral therapy you hear over and over again is you have to be willing to do the work. You have to be willing to do the work. So a client that is still contemplating change may not be ready for CBT, and so therefore the therapy may not be effective till they're actually ready to do the work. So another major weakness of cognitive behavioral therapy is it may be ineffective for thought disorders like schizophrenia, psychosis, or organic brain disorders. A key staple of CBT is thought analysis. So if the client is unable to analyze their thought, or their thought isn't reality-based, then it's going to be hard to foster useful interventions and coping skills. For example, if someone thinks that their phone is bugged and there's nothing you can tell them to say their phone isn't bugged, because they can actually challenge you, like, how do you know? Are you a phone expert? If the client's thoughts are not based in reality, then it's going to be hard to actually derive on interventions to actually move them forward. Another example, if you see my buddy here, this is Mr. Hannibal Lecter. I'm not sure Hannibal Lecter would have been a great candidate for CBT therapy. He may have needed something a little bit more intensive. So once again, CBT is great if you're able to dive into that, thought analysis, and usually less acute diagnosis versus high-level diagnosis like schizophrenia, psychosis, or just straight up crazy. Another weakness, and just to double down, is not only, as we stated earlier, that CBT isn't the best for processing trauma, but it's also not the best for processing past experiences. CBT potentially overlooks past experiences, which causes the overlooking of root causes. And sometimes in therapy, if you can't get to the root cause of a thought or a root cause of behavior because it's based in the past, and CBT is more of a current-based therapy based in the present, then you'll be unable to derive actual interventions that can help initiate a solution to change the behaviors. So just like with our example of our buddy Batman, without him processing the death and the murder of his parents, it would be really hard to get him to buy into or get any type of growth with the therapy utilizing just CBT only and traditionally practiced CBT. This next weakness is a little surprising. CBT may not be effective for long-term conditions like forms of depression or bipolar disorder. So you may remember that in phase 1 of this presentation, we talked about CBT was derived from research on depression, but the key factor is that makes it a weakness is that there are many forms of depression. And so there are limitations. Once again, CBT is really good for more so less acute diagnosis. So if you have a variant of depression that's more high level, like bipolar, you have those highs and then you have those lows, CBT might not be the best treatment style for those diagnoses. So just to give you a visual example, you see in this chart here that there are many forms of depression. So CBT would probably be better for kind of the less acute ones, as we mentioned, and then the higher acuity of depression that involves different factors that just can't be over processed or thought away, then that would be more than likely for a CB therapist a referral to a different form of therapy to kind of get the best outcomes. So for all my parents out there, do you recognize this? This is a homework folder. Homework is an essential part of cognitive behavioral therapy. Unfortunately, one of the weaknesses of cognitive behavioral therapy is clients often skip the homework assignments, reducing the effectiveness of CBT. When you don't utilize the interventions of CBT, you're not going to get the maximum results of the therapy treatment. According to the research, another weakness of cognitive behavioral therapy is at times CBT may culturally not be appropriate for populations due to language and cultural barriers. So in phase 1, we did discuss that CBT can be utilized cross-culturally, but if the provider is not culturally competent or culturally aware of their, let's say, target population, or if there is some type of language barrier, then CBT can be ineffective because it will be hard to challenge thoughts, feelings, and behaviors if you're not culturally competent in that specific culture. So for example, let's say, and a lot of CBT therapists do travel internationally to teach the theory and have the theory practice in clinics around the world. But let's say we're traveling to, Nigeria, for instance, and that provider doesn't speak the language of the tribe of that area. They're not familiar with the cultural customs of that area, and they're teaching Western CBT, then CBT at that point will be ineffective. Now, there is culturally informed CBT, so that makes it effective. But without that cultural component and cultural awareness, CBT would be ineffective in that instance. The last weakness I'll cite is that CBT may overlook interpersonal and environmental factors that influence mental health. So we have a lot of in-clinic adjustment disorders, and sometimes the diagnosis of adjustment disorder is based on what's happening in the environment at that time. So CBT, as we discussed before, reframes irrational thoughts or negative thoughts or thought distortions. But in certain environments, let's take, for example, racism and discrimination, over reframing that and telling a client, well, just think of it differently, or let's think of another way that may or may not be true. That's actually can be invalidating to that population, because racism and discrimination is true. And if that is their social frame of reference, then you can't really reframe that. So CBT may be ineffective for populations who are struggling with those type of interpersonal issues or environmental issues. Let's start with comparing and contrasting the cultural component of CBT. So CBT can be practiced cross-culturally. The practitioner or the therapist has to be culturally competent. They have to be able to, if that population does not speak their language, they have to be able to speak the language. Obviously, for CBT to work, they have to also be able to understand the original culture. So if they're teaching CBT to, a non-Westernized culture, then they would have to kind of immerse that together in order for CBT to be effective. If they don't know the belief system and the customs of that culture, CBT is based on our thoughts, beliefs, and behaviors. So therefore, the CBT work will be ineffective, and more so, you're kind of pushing your own thoughts, feelings, and behaviors as the therapist onto the clients of that culture, and that would also make CBT ineffective. On the other hand, CBT is, let's think about it like religion. So we have missionaries that do missionary work all over the world, whether it's for Christianity or for Muslims, and that's where you see different cultures all over the world. I'll use a specific example. I am a first generation American. My parents were immigrants, but along the way when they arrived in the United States, they were visited by Mormon missionaries. So those missionaries were able to explain that religion and belief system behind the religion to where my parents converted to being Mormon, and we practiced that for quite some time. So in relation to CBT, if the provider and the therapist is culturally competent and they're able to explain the treatment and the basis of the treatment and the interventions in a way that does not undermine the core culture of the population, then CBT can be very effective. Next up, let's compare and contrast depression. So I know we touched base on depression a little bit earlier, but it was both on the pros list for the strengths and the cons list as a weakness. So let's just highlight that one more time. So yes, cognitive behavioral therapy works well for depression. It was derived from clients suffering from depression, and there's a bunch of evidence-based research and studies that support the efficacy of cognitive behavioral therapy with depressed clients. However, there are different levels of depression, and you have the more acute forms of depression like major depressive disorder and bipolar disorder, which has a component of depression that CBT may not be the best in treating. When there are long-term cases of depression, meaning have lasted for years and years, sometimes you need to mix therapies or find the cause. So if the therapy was more so related to maybe a traumatic event, then you might need to refer to a trauma-informed therapist versus just CBT alone. So just to be clear, CBT is effective with depression, but it's for milder forms of depression where you see the best results, and most of the evidence-based research is for milder forms of depression, which would look like situational depressions. Maybe someone passed away, or maybe there is some type of adjustment issue that's taking place, some type of trigger that's happening, but less so something that's consistent and persistent. So consistent and persistent depression would be more of an acute stage of depression, and that would not be the most ideal treatment modality for that form of depression. So lastly, let's compare and contrast substance abuse disorder. So yes, CBT is also effective for substance abuse disorder due to its structure. If you challenge your thoughts and behaviors and actions, then and you work CBT the way it's supposed to be worked with traditional CBT therapy, you use your coping skills, you avoid triggers, which in substance abuse is usually people, places, and things. So if you're working on avoiding triggers, changing your thought process, changing, reframing thoughts like I need to drink versus I don't need to drink to dot, 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 then you can see great changes and significant changes and progress with individuals with substance abuse disorders. However, on the other hand, a big component of CBT is doing the work and doing the homework. And so if someone with substance abuse is not yet in that phase of, I'm ready to, make amends, I'm ready to do the work, I'm ready to challenge these thoughts, I'm ready to change the people, places, and things around me that are my triggers, if they're not in that state, then CBT can be ineffective for substance abuse disorders. But for the most part, if that client is ready to do the work, CBT is effective. If they're not and they're still in that pre-contemplation phase, then CBT would not be effective because it requires you to challenge the thoughts, to show up, and to commit to the treatment. Well, that is all, folks. I hope you enjoyed phase 2 of my presentation on cognitive behavioral therapy. Bye-bye.